Hello and welcome to another edition of Feel This Pain. I'm Ken McKim, and tonight we're going to be talking a little bit about a condition known as gastroparesis. So what is it? Well, it's basically when your stomach, for whatever reason, can no longer contract properly in order to efficiently crush and move food out of your stomach into your small intestine. This is also sometimes known as gastric emptying. So what causes it? Well, in a lot of cases, it's damage to a nerve called the vagus nerve. Not that vagus. But all too often, doctors don't know what causes it, and so they label it with the term idiopathic, which is the fancy medical way of saying we don't know what causes it. We hate that word on this show. So as you might expect, gastroparesis does come with its own set of not fun symptoms, including things like heartburn, nausea, vomiting of undigested food, that's always fun. Then you've got things like abdominal bloating, poor appetite, and as you might expect, feeling full quickly because of the undigested food in your stomach. So after hearing these symptoms, some people might be thinking to themselves, well, what's the big deal? You're telling me I can get a disease that can help me lose weight and feel full all the time. Where do I sign up? Not so fast. This isn't just a little tummy trouble here. This has some very serious medical consequences to it. I mean, think about it. If you're constantly vomiting up undigested food, that means it's not staying inside your stomach long enough for it to have the nutrients extracted from it back into your body. So malnutrition is a serious risk. Also, vomiting constantly leaves you dehydrated. That can kill you. And it can leave your electrolytes out of balance, which carries its own set of cardiac complications. And then there's something called a bezoar. What is a bezoar? Well, remember that undigested food we spoke of earlier? It's just hanging around in your stomach, and so it's going to get together and form this ball of destruction that sits there and causes pain in your stomach, or it moves along into your intestines, and it can cause a bowel obstruction, which can cause tissue death, also known as gangrene. And if you've got dead tissue inside your body, it causes an infection called sepsis. And sepsis can lead to death. So there's some very real consequences to living with gastroparesis. And you're probably also thinking, well, I just have to modify my diet a little bit, right? Just give up a few of my favorite foods maybe. I can push through it, no big deal. This disease can and does progress to the point where you can no longer eat regular food. In fact, for you to get any nutrition, you have to get it through a paste. It's in a bag, and it's forced into your body through means of one of these. Yep, feeding tube. As you might expect, these are not comfortable, and they are prone to infection, which is just as much fun as you think it is. Honestly, people with gastroparesis would like to just eat normally like the rest of us do. And that brings up a side of this disease that few people seem to consider when they're discussing it in forums, and that's the social aspect. We tend to forget that as a culture, most of our social activities revolve heavily around eating food. Think about it. You've got 4th of July, you've got Memorial Day weekend barbecues, you've got birthdays, weddings, bar mitzvahs, you have Thanksgiving dinner, you have Christmas dinner. Even just dating revolves heavily around the ingestion of wings, pizza, and beer, right? I mean, for someone with GP, just a simple dinner date can be very intimidating, especially when everyone else's food looks like the plate on the left and their dinner is the bag on the right. Yummy. So are there treatments? Well, yes, of course. There's medications you can take. You can alter your diet a little bit, as we mentioned earlier. There are even surgical options available to some. One of which is very intriguing to me, and I want to get this right. It's called electrical gastric stimulation. Basically, it uses electricity to force the stomach to contract. Now, this doesn't actually help the gastric emptying process, but it has been shown to bring relief to the symptoms of the vomiting and the nausea, which a lot of people experience with GP. So that's hopeful, at least. Bottom line though, this is a life-altering disease. So if you know someone with gastroparesis or you meet someone who has this condition, I would implore you to give them the respect they deserve, because they're dealing with a lot. They deserve that respect and they deserve your compassion, so I hope you will give it to them. And that's all the time we have for right now. If you would like, go ahead and send me your questions to ken@don'tpunishpain.com. You can also follow me over on Twitter @don'tpunishpain, as well as some other links where you can learn more about gastroparesis, should you be so inclined. And that's all we have time for today. Thank you so much for joining me, as always. Until next time, I'm Ken McKim. You take care.